In this visuals, we'll be learning about diabetes. Diabetes, it's a Greek word which means frequent loss of fluid from the body, that is polyuria. It is a chronic metabolic disorder in which there will be high blood sugar levels. Let's see how our body works. When we consume food, it enters to our stomach. Digestion in the stomach converts food into glucose. This glucose enters to the bloodstream. Then pancreas produces insulin. On our cells we have insulin receptors through which glucose enter into the cell. This glucose is broken down into energy. It is used by the muscles or else stored in a liver as a fat for further usage. This is how it works. When you have type 2 diabetes, pancreas fail to produce an insulin or produced insulin is not used by the body. Why does this happen? Let me explain. When you have a visceral fat, excess fat around your abdomen releases inflammatory cytokines which directly interfere with insulin signaling. Sedentary behavior of you reduces the muscle ability to absorb glucose, leads to reduced sensitivity. High intake of sugar and refined products causes constant spike in the insulin, which leads to cell becoming desensitized. Excess fat, high triglycerides can impair the insulin. Type 1 diabetes is an insulin-dependent diabetes mellitus. It is a juvenile diabetes in which there will be impairment in the insulin production. There will be no insulin production because beta cells in the pancreas will be destructed. So we can call this as a hallmark of type 1 diabetes. Other type is gestational diabetes. This occurs during pregnancy without previous history of diabetes. There will be a high blood sugar which is usually caused by placental hormones. You will find symptoms like polyuria, excessive urge for urination, polydipsia, an increased thirst, polyphagia, increased hunger, burning sensation in the palms and sole, fatigue and general weakness. Treating it needs a strict diet advice and a physical activity. With medications like biguanides, metformin, 250 to 500 mg, one dose after food, often adding gliclazide 40 mg before 30 minutes of taking food. In severe hyperglycemic state, insulin is needed. Stay healthy with Dharaveda. Subscribe for more videos.